Angelo Giardino. I'm the Chief Medical Officer at Texas Children's Health Plan, and this is another podcast in our series that we hope are useful to you in terms of keeping up with any new developments in healthcare. April is Child Abuse Awareness Month, and we thought we'd take an opportunity to reflect upon our practice around child abuse and neglect in our health plan. So first, let's look at the statistics. Child abuse and neglect is really a huge problem. If you look at the United States, each year there's approximately 3 million reports made to the authorities. Those are collected and processed, and after investigation, we know that on average there's about 700,000 children who are abused and neglected each year in the United States. Of course, 700,000, that's a huge number. Of that 700,000, the vast majority are substantiated for neglect, where a basic need is not met. Probably about 20% are for physical abuse, and then there's a small number, under 10%, for sexual abuse. If we go one level deeper and just look at Texas, in 2010, there were about 268,000 reports. After those were processed, about 65,000 cases were substantiated. So in 2010, 65,000 children were abused or neglected in Texas. And then regretfully, in 2010, 222 children died as a result of child abuse and neglect. So, if you do the math, that's a little more than 2 a week died. If you go one level deeper and look at Harris County, about 36,000 reports were received. Those were investigated, and about 4,000 children were known to be abused and neglected in Harris County in 2010. And then sadly, in 44 of those children died. So that's a little bit under 1 a week. So it's a huge problem, and it's one that we really have to address and confront. Okay, enough on statistics. Let's look at the clinical. Each year, again, it's tragic, but we find that parents lose control and they harm their children. It's an unpleasant reality. And what we would ask of you is that, obviously, in your primary care visits, that you would, of course, assess for neglect or basic needs not met, or if there is an injury, listening to the history provided by the parent, see if that's consistent with the examination. Sexual abuse really presents completely differently. So sexual abuse has different dynamics. It's not really related to parenting as much it's related to a perpetrator who wants to have access to children. And frequently with sexual abuse, the caregivers will raise some concerns to you, and a lot of primary care providers don't feel comfortable assessing sexual abuse, and that's where you can use the Children's Assessment Center or the child abuse team at Texas Children's Hospital to request a referral, and we can do a consultation. If you do confront a case where you think abuse may have occurred, of course you're a mandated reporter. All of us in healthcare are mandated reporters. So if you have a case where you suspect child abuse and neglect, I would encourage you to comply with your mandated responsibility and make a report. And there's a number on the bottom of your screen. There's an 800 line, the abuse hotline. And you can also make the report via the Texas abuse hotline, and that website is listed as well. As a mandated reporter, you are required to make that report. If you make that report in good faith, the state will provide you with some immunity. If someone gets angry and brings a suit against you, you can claim immunity, and that's the upside of the mandated reporting responsibility. If you fail to make the mandated report, actually you could be charged both criminally and civilly. So it's really an important responsibility, and I really encourage you to take full advantage of the child abuse team at Texas Children's Hospital. We're always available for consultations should you have a question. Prevention is really the solution. And we're really fortunate in Houston in that we have a number of resources directed at prevention. So for example, Texas Children's Health Plan sponsors a nurse-family partnership. So each year we have 100 young first-time mothers who are enrolled in the program, and they get 2 years of nurse home visits. And during those 2 years, which start before the baby's born, happens at delivery, and then for about 18 months after the delivery, a nurse goes to the mom's house and coaches her through her parenting. If there's a father involved, the father can get some of that coaching as well. So the Nurse-Family Partnership is one really important evidence-based prevention programs that Texas Children's Health Plan sponsors. And this year, in 2012, we are launching a Healthy Families America program. That's a program where lay home visitors are assigned to the mother, and if we can, we try to do that before the baby's born. If not, we can do it after. And there's a set of visits that will occur by this lay home visitor, and the lay home visitor works through a curriculum with the mom and hopefully the dad and helps them through their parenting. So we really believe in prevention, and we think that's the solution. If you'd like to get more involved in prevention efforts around child abuse and neglect, particularly since this is April, and April is Child Abuse Awareness Month, please get in touch with Prevent Child Abuse Texas, which is the Texas chapter for Prevent Child Abuse America, which is the national organization that shares resources around preventing child abuse and neglect. I'm Angelo Giardino, Chief Medical Officer at Texas Children's Health Plan, and I thank you for your attention today.